And now, is there any other? We will move into Professor Kim Hee-jin's presentation on effective isolation and the tracing of context management data reporting system. So, and the treatment procedures and methods. So this, I would like to ask Dr. Kim.
Hello, thank you for this opportunity, and I'm Hee-jin Kim from Graduate School of Public Health, Yonsei University. I'd like to present on patient classification and treatment briefly.
It is isolated.
Including this subject. Among the public health responses, I present the contact management and treatment, but I think number 5, treatment of non-COVID-19 patient is also very important because every day we have various patients, and the primary and usual health service delivery should not stop. That's why we are trying to protect hospitals apart from any COVID patient through intensive epidemic investigation. For the confirmed patients, the central and local government promptly conduct epidemiological investigations, and there are 3 isolation types according to the place of safety. Self-isolation, facility isolation, and hospital isolation for patients. Identified are under self-isolation and thoroughly managed on one-on-one basis by Ministry of the Interior and Safety and local governments. Actually, the health workers, they are banned, and violations will be imposed with a fine. These are self-quarantine guidelines and guidelines for family and cohabitants. Avoid contact, make distance, and use materials separately, etc. And the first cognitive public health center registered the contact list in the system, integrated disease health management system run by CDC. Within 24 hours, self-isolation measures are implemented for the contact person, and confirmation of medical institution or group facility exposure is done because priority will be given if the patient have been hospitalized as a patient or a hospital employee. This is health education materials, and for patient classification and treatment, high-risk group has priority for hospital admission, and it is important for bed allocation. Older age, chronic disease, special conditions such as hemodialysis, admitted patient with low oxygen saturation, and recently, tobacco smoking was added as high-risk criteria. The Korean Society of Critical Care Medicine and other academic groups recommended for severe COVID-19 patient care. First of all, they recommended to designate medical institutions with the capacity to treat severe patients according to geographical region based on their capacity to manage critically ill patients. Key point is equipment, such as intensive care specialists, nursing, and ECMO experience. This kind of triage process of high-risk patients allowed to allocate patients among hospitals for severe or mild patients. high-risk patients should be transferred to a hospital equipped and prepared for these patients. Because we don't have enough beds, particularly in endemic areas such as Daegu, Korean government invited several facilities originally employee training centers and other centers and made these facilities into isolation places for mild case patients. Though they are not hospitals, several doctors and nurses care those patients, and if they find any severe case, they transfer to the hospitals. Another type of hospital is safe hospitals, which applied and listed as safe hospitals from government. They have separate entrance and separate walking pathway between respiratory and other kind of disease patients to prevent COVID-19 among patients. For treatment procedure and method, early warning score based on vital sign, even if the infection patient or suspected patient with mild condition that does not require oxygen therapy is useful for early recognition and critically ill patients and can be applied to clinical practice. Medical staff should manage patient in the airborne infection isolation room. They should adhere to the following guidelines: personal protective equipment, level D, sometimes an nebulizer treatment should be prohibited. Mechanical ventilation is not recommended as a routine. And room air ventilation is important, and when performing aerosol generating procedure, it is advisable to wear level D procedure, and there is no standard antiviral protocol for COVID-19 patient. However, the use of antiviral agent is highly recommended for severe symptom patients as early as possible. There are several treatment options, Thank you for your attention.
Thank you, Professor Kim.